Hi, everyone. My name is Kelly.stroot. I am a talent advisor on the nursing team at BJC Healthcare, and today I am speaking with Allison Cecil. She is the nursing manager for the Integrated Spine Unit at Barnes Jewish Hospital, also known as Big Barnes, right? Is that what people call it when they don't know the specific
Yes.
term?
Or downtown.
Downtown.
Yes.
We are talking about this unit because it's a new unit. It opened in April 2022.
hmm
And it's a unit I also support and partner with Allison on to hire nurses for. So we work closely together to kind of build a team. And we've just started working together not very long ago,
Yeah, about a month ago.
about a month ago. So it's
Yeah.
been fun.
Yep.
So thanks for agreeing to do this. This is kind of a different form of sourcing, that I like to do just to help kind of get the word out about new things. And this one in particular is just a really big deal, in my opinion, because it is so new. I think a lot of people in the area aren't quite aware that it's here, but it is a really big deal for St. Louis.
hmm
So I'd like to kind of pass the torch to you
Sure.
and allow you to introduce yourself and tell us a little bit about your background and then tell us all about integrated spine.
Oh, absolutely. Well, thank you for doing this, Kelly. I think this
Yeah.
is it's important to get the word out because not everybody integrated spine. Even myself, I had to do some research when I found out about the position. So I've been a nurse. Oh gosh, going on 12 years now. My first career, I was a school teacher, taught middle school math and social studies, and then took some time off and had my kids and started my family. And then wasn't sure I wanted to go back to the classroom and decided to go to nursing school. Teaching and nursing are very, very similar. You do a lot of similar things. So got my nursing degree and started off as a tech while I was in nursing school here at Barnes. And then I stayed on that unit once I graduated from nursing school and worked on a pulmonary progressive care unit and in critical care for, oh gosh, started there in 2011. So 5, 6 years I did that. I was on night shift because new grads start on night shift. And that was kind of wearing on me. So I took a different position and started working um, in case management, which eventually led me to went to Mercy and worked in Mercy Virtual and started a new program at Mercy Virtual that I was involved with engagement at home, which was working with technology, and they were noted as a hospital without patients because we did everything virtually. We had our appointments virtual. Patients took their vitals and would report to us daily. And we would try to intervene before issues got to the point where they would require the ED or hospitalization. So it was a great experience. But I did get an opportunity to branch off from that engagement at home that was new and up and coming and pilot a new program there, which was a more acute type situation that we took from the typical, we were seeing patients from 7 in the morning to 7 at night. I was able to help and build that program. So we got it to a 24/7 model. And then a leadership opportunity presented itself. And so I took a management role in another system. So I have worked in all three systems.
Wow.
But while I was there, this opportunity presented itself. And being part of building things, that's really kind of what pulls at me. That's what I enjoy. When I was a staff nurse, we opened the advanced heart failure unit here down on 6300, and so I got to work in the as that was being piloted and started. It was a 6-bed unit that they still have today. So I got a taste of that as a staff nurse. I got a taste of that when I was over at Virtual. And then so seeing this new unit that was going to be here at Barnes, I thought, okay, I get to go back downtown or to Big Barnes and I get to start a unit. So, best of both worlds. So what appealed to me outside of that is that integrated spine is something that we don't, this is one of a kind in the Midwest. This isn't something that we see just anywhere. Which leads you to say, what is integrated spine, right?
Right.
So what Barnes has done is we had our neurosurgeons doing spine surgeries and spinal cases, and we had orthopedic surgeons that were doing the same. What integrates them is that we're trying to bring it together and do a standardization of care, if you will. So we have both the orthopedic and the neurosurgical cases. We have them all in the same unit. That way, the nurses are trained together. They're learning the different procedures, because the orthopedic surgeons sometimes have different ways that their management of their patients is somewhat different than the neurosurgery patients, but we're trying to standardize care as much as we can. So that's what's exciting about getting to start this unit, is that everybody has a voice in helping to build this as it grows.
Yes.
So integrated spine, essentially we take care of the whole gamut, really. We have minimally invasive procedures where our patients are staying 24 to 48 hours with a discectomy, fusions. We have laminectomies that we're doing. We have more complex procedures that we're doing with patients that have kyphosis, scoliosis, flat back syndrome, spinal cord injuries. We do see that as well. The other thing that we do here is we treat patients that have spinal stenosis, but also spinal tumors. So we're dealing with oncology as well. And so looking for different treatments, and we have a whole bunch of resources that we can pull on, being that we are Barnes in the teaching facility. So we get people that come here from all over the world, which was something else that was really exciting. And I felt like such important work is being done here, and I really wanted to be a part of that.
Yeah.
So there we
Yeah.
go, in a nutshell.
In a nutshell, in a nutshell. And with it being a new unit, does that mean, the floor has newer technologies and, the nurses kind of get to play and work with new technologies on the unit?
They are seeing and new procedures, being that we are a teaching facility. Barnes is known obviously throughout the metro area, but they're known throughout the world as being one of those facilities that they develop kind of the gold standard, if you will, for different types of procedures. Translaminar fixation was a procedure that basically it treats the instability of the C1, C2 junction, but that was a procedure that was developed here that is now being used by surgeons around the world.
Wow.
So,
Wow, that's really neat.
it is. It's really cool that, to think that you're a part of that too, and that you're treating
Yeah.
those patients and working with those doctors. You're working with the surgeons, you're working with the residents, the fellows, which I enjoy that as well, because you're getting to see, that's the teacher side of me. I'm getting to see these people progress in their career.
Yes.
But that's the other part that, I think with new nurses, that it's really important to watch the new nurses as they come in, and watch them and help them with their growth as well. So
Yes. Yeah, and I think that segues into something I really wanted to bring up. I think one thing that I really admire about you as a nurse manager is that you have that mentorship mentality. You have that teaching background, and so you really do want to see your nurses grow and succeed in their careers. And so, having this opportunity to not only work on this really cool new unit that's doing some amazing things, but also work under a manager who is going to help you become the best at your job, is a very intriguing thing to kind of have dangled in front of you. There are new nurses coming out of the woodworks, and they have plenty of options to choose from right now. But I think specifically this unit could be an amazing starting point for so many new nurses out there, who want to learn and grow and be supported along the way. And how cool to have, like, you worked on a brand new unit, the only one of its kind in our Midwestern area. To have that on your resume would look kind of cool, in my opinion.
oh, absolutely. Oh
Yeah,
yeah. I mean,
yeah,
um, it can't do anything but help to have that on your resume. I mean, the
right,
fact that you work at Barnes in and of itself.
yeah,
And I was told when I graduated, if you can work at Barnes, you can write your ticket anywhere. So you add the fact that you joined a new unit and you helped shape that unit. You had a voice, and you had, you were part of the fabric that it became.
right.
That is something that's, you're not going to get that opportunity very frequently. I've
Yeah.
been fortunate that I've found it and kind of fallen into it a couple times, but um, it is an exciting opportunity. As a new nurse, I'd love to say that anybody who starts on a unit that I've worked on or managed on, they're going to stay there for their entire career, but that's not the reality.
It's not. Yeah.
We're all here. I think there's a commonality among nurses that they're lifelong learners. They're craving more. They want to learn this. Okay, I've learned about this procedure. Now that takes me to this, or that it takes me to this disease process. And so we're learning more all the time. And so as a manager, my job is, I feel, is to make sure that you have all the tools that you need to be successful. And then once you have gained that personal success, are there other areas that you want to look to be successful in? If that means you want to take a leadership path, let me help you get to that leadership path. Are you looking to go to further your education? You want to become a nurse practitioner or a clinical educator? Let me help you get on that path, whatever we can do to do that. If
Right.
you're interested in other areas, like I said, I'd love you to stay with me. But if you've got a passion for something else, or you just want to know more, let me put you on the right track to get into another area. So
Yeah.
um, we have to grow our own, if you will.
Yes. Yeah, and I 100% agree. I think it's somewhat freeing to hear, in my opinion, a manager say that too, because I do think that that has to be somewhat of a nerve-wracking situation as a new nurse to not really know exactly where you want to start, but also feel bad internally if you know you don't want to be there forever. And will
Sure.
that hurt anyone's feelings? And the answer is no. We are, like you said, a teaching hospital, and the BJC organization as a whole, they strive and they do everything they can to see their staff grow, and they do whatever they can to assist in that. So I think that you play into those values perfectly as a manager, and I think that that is something that is going to really kind of feel nice to hear from a new nurse. You know,
Sure,
um,
absolutely. I mean, I don't know that we ever know what we want to be when we grow up, right?
right? Exactly,
So
exactly.
we've had nurses that they worked here for a while and then they want to see the other side, so they go to the OR, which
Yeah,
that makes perfect sense to me. I see you afterwards. I want to see you before, and I want
yeah,
to be part of
yeah,
that process and see, what are we doing? What are the surgeries that we're doing, and learn about that. So it is a natural progression to me.
yes,
And so as much as we hate to lose the nurses, they go and they get their time and they experience what they want. But you know what? My hope is that maybe they will come back someday.
yeah,
You go out
yeah,
and you see some other things, and then you decide, you know what? I think I want to go back to where I started, or I want to go back to my second, or wherever it was in your career. But um, you can never have too many skills in your toolbox, right?
yeah. And I think that's what sets our nursing aside from other organizations as well. I think having that mentality as an organization, and just wanting everyone to succeed and be the best, and giving them every segue and opportunity to do that. And that is why people choose to come to BJC or
Absolutely.
Barnes specifically as well, because they know they're going to get the best care. So yeah,
Absolutely.
I
I
think
think
that
from
that's great.
a staff standpoint, I mean, the support that you get. I mean, like I said, I've worked in um, the multiple systems here in St. Louis, and one of the things that I'm very proud of this unit is not only do you got your manager, we have assistant nurse managers, we have a clinical educator that's on the unit that's there to support the nurses. They are starting a mentorship program for night shifts specifically because they've recognized that night shift new grads don't necessarily get all the support that they may want or need.
Wow, I didn't
Yeah,
know that. Wow,
yeah.
that's so
So they
great.
started this mentorship program that is specifically for new grads, which I think, gosh, I would have loved that. I
I
mean,
was just gonna say, I think that is something that new nurses have mentioned to me before, and not even just new nurses, but experienced nurses who are new to this hospital.
mhm,
If they choose a night shift position, how are they gonna be ensured they're going to get the same amount of mentorship and preceptorship as day shifts. So
Exactly.
I think that's awesome.
Yeah,
That's
yeah. So I
wonderful.
was really excited to hear that that is something that we just learned about recently, that that's in the works. They're trying to get the mentors on board right now, which I think just speaks to the organization that, they are hearing that there are needs out there and they are working to see what they can do to fulfill those needs. So,
Absolutely. That's great.
it's getting that support there. We do have a full A&M staff, assistant nurse manager staff. So I
Good.
do have assistant nurse managers on day shift as well as night shift. So that support is there,
And
which
you have
is
nurse educators, right?
the nurse educator. She is here. She fluctuates with her hours. So she will do like a 7 to 7 day shift, but she'll come in on the weekends and see the weekend staff because we do
Oh,
have weekend
good.
option positions.
Hmm.
She'll come in later and stay into the evening to provide that support that is needed. So there is a lot of support. In
Yeah.
addition to that, the unit it's great that we have our own physical therapy gym up on the unit. We
Yes.
have physical therapy, occupational therapy that they work with the patients. We also have our nurse practitioners that are here on the floor. They get here at 5 o'clock in the morning. They're supposed to be here till 5 o'clock at night. A lot of times they're staying till 6 or 7 at night. They have their phones on, say, call me until 9 or 10 if you need something. We do have the resident support after hours. But there is somebody physically here a good portion of the day.
Good.
So for the night shift person, that's great because you get to see them in the morning. You've got that from 5 to 7 in the morning where you can check in with them and get to know them and understand, you know, if this happens, this NP would do this NP would do this. You build those relationships
Yeah.
because they're not here just in that 7 to 7 where
Yeah.
it's just for day shift.
Okay.
So there's a lot of coverage. There's a lot of support, which I think it is great. And I think that really builds that foundation that you need as a new nurse when you have all those questions,
Yeah.
maybe feel
Absolutely.
uneasy about stuff. You do have the people here that can answer those questions for you.
Yeah. That's got to be really nice to hear and know. And I think, as someone who might be looking at a new position for nursing, having this opportunity to hear you speak about the unit and what the unit entails before they even know there's an application process, available for the unit.
Sure.
It's not very typical, right? That you have that opportunity to learn all about the unit, to hear it from the nursing manager's mouth before you even apply for the job. So I think that's why something like this is going to be so helpful to everyone who sees this. Before we log off, I do want to ask you about the nursing staff that you have currently and kind of what the morale is like and what maybe a day to day would look like for them on the unit, just to kind of give anyone listening a glimpse into the life. But tell us about it. Tell us about the day to day and like
Sure.
what a nurse would expect to see in a day to day.
So we start a day, every shift, morning shift, day shift, night shift. It always starts off with a huddle. We bring everybody together and we will just discuss, you know, updates about things on the unit. We'll review how many surgical cases we're anticipating for the day, how many discharges, if there's any particular patients that we need to kind of keep an ear out for. We have some concerns. We'll discuss that. We love to celebrate up here, so any type of recognition, we will make sure that it's up on the huddle board. We're talking about it, celebrating. We've had multiple Daisy Award winners on our unit, so
Oh,
we'll
love
celebrate
that.
that during our huddles. And that usually takes about 5-10 minutes, and then you're off and doing bedside shift report. So you'll meet up with your nurse, go into your patient's room, get report, involving the patient, having the conversation with the patient too, so that they feel like they're part, because we're all a team, right? We're all
Mhm.
treating the patients together. And then the nurses meet with their techs also, and they have just bring the tech up to speed as far as the patient has, AccuChecks, if they have vital sign, what the requirements are and things of that sort, just so everybody's on the same page. And you go through doing your med passes and just checking on your patients. At 8:30 every morning, we have a process, interdisciplinary rounds, where case management, social work, the nurse practitioners, physical therapy, occupational therapy, your charge nurse, your A&M, myself, we all meet in a room and we go through the discharge plan for the patient. So you'll come in, report off what patient you have, and the nurse practitioner will kind of say, this is the plan for the day. We're trying to get them discharged. Social work and case management will weigh in if there's anything that we need to consider. A lot of our patients do go to the Rehab Institute here in St. Louis. A lot of
Oh
them
yeah.
go there for rehab.
Mhm.
But we utilize a number of other rehabilitation hospitals in the area. Some of them do go to skilled nursing facilities, and then we do have the group that go home as well. So we talk about what their discharge plan is and what really we want to identify any barriers. How
Yeah.
can we help you get your patient discharged? So after that, then you go about the rest of your day. Again, as I said, we've got the patient care techs, student nurse techs, PT and OT, lots of teamwork on the unit. I'm amazed at the teamwork and how people just work so well here together.
Yeah.
And so our ratio up here is a 3-to-1, 3 patients per nurse. So you have that opportunity to get to know your patients and spend that time that you need to spend at the bedside.
And how many beds?
So it's a 20-bed unit.
Okay.
So we've only opened 16 of those beds though, because of staffing concerns.
Mm-hmm.
And I'm just going to shamelessly plug our director, Annie Lemura. She is a saint. She supports us 110% and
Yes.
recognizes that there are days that we don't have the staff to accommodate all 20 beds.
Yes.
So she will let us cap, which is amazing.
Yeah.
So
Very
recognizing
helpful.
the need to have that safe ratio, right?
Yes. Yes, absolutely. It's so important. That
So
is so wonderful that she does that.
she does, and she's so visible. She's on the unit. That's another.
Oh, good.
Yeah, she's
Yeah.
up here, and she's hands on. She'll get into a room, help a patient go to the bathroom, turn a patient, do whatever. I mean,
That's good.
yeah,
Yeah.
can't say enough wonderful things about Annie. She's great.
Yeah.
So you just wrap up your day about 7 o'clock. By 6:45, getting everything wrapped up. 7 o'clock, night shift is in. You'll huddle again at night at 7 o'clock, and you'll do the bedside shift report again. This time you're giving report off, saying goodbye to your patients, leaving them in great hands with the night shift. And, that's about the day. Go home, get a good night's sleep, and come in and do it all over again the next day.
And the shifts that we have available are 3 12-hour shifts.
Yes.
That is full time. And I'm happy to give everyone, if you email me or contact me, I'll leave my information in the description, but
Sure.
I will absolutely email you what compensation would be, our benefits. I mean, we're very transparent. Like I said, you don't have to promise us anything to get this information. We just, you want you guys to know that we're here and we are happy to have you.
Yeah.
So
We have day
yes.
shifts, we have night shifts. So whatever you prefer at this
Yep.
point. But yeah, we're just, here to, if you want to take a look and come and see if it's something that you think you might be interested.
Yeah.
Get in touch with Kelly.
At any time you can come and shadow. You just need to contact me and we'll set something up. You don't ever have to commit to anything. If you just want to check out the unit, and if you're a new nurse, it's never too early to just check it out and look at it. Thank you so much, Allison, again for doing this, and contact me if you have any questions or you want to meet Allison in person.
Sounds
Make
great.
it happen. All right. Thanks so much.
Thanks, Kelly.